All right, welcome to News Talk with Brandon and Bob. I'm Brandon Jones, sometimes called Pops on Pop Culture, host of What's Your Story, and with me is my longtime friend, someone that you know and love, the editor-in-chief of Outbreak News, the infectious disease guru himself, sometimes affectionately called the worm and germ guy. Yes. Yeah, I call him Bob. Some people call him Robert, not Bobby, not Rob. Robert Herriman. Here we are, Bob. Here we are live with our first show. Bringing it in the middle of our Florida monsoon.
We are here.
We are.
We are here. Big storm going on, but nothing's going to stop the show.
Yeah, well, we say that, and then the light will go out.
Yeah,
so
well,
we're going to praise God that this goes off without a hitch. So it's our first show. We're so excited. We're bringing back that old dispatch radio feel of things, trying to cut through some stories, give you an idea of some things that we're paying attention to, hopefully cutting down to your time, taking in a bunch of this garbage news and that kind of thing. So
let's take a look at it.
Yeah, so right off the bat, I want to jump right into COVID. I think that's the story that's consuming everything, and we can cue the little CDC alert at the bottom of the YouTube version of this. If it's not there, folks, it will be there.
Yes, it will.
But I want to jump into that first, and I want to start with I go to a site called worldometer.info. Worldometers.info. I'll put a little link there, and it's kind of basically just a bunch of data.
So that's similar to the Johns Hopkins one.
It's a little bit more comprehensive for me in that it pulls in a lot of real-time data. It goes countries. You hit countries. It breaks it down into okay. So, but where can people get good data? Like, people right now are probably given all sorts of data. When does it report? How do people even sift through the data? What do you do? Do you use Johns Hopkins? Do you use something else?
Yeah, I basically use Johns Hopkins, and then I determine what's going on the Johns Hopkins map, and then I go to that Ministry of Health. I get it straight from the source, whether it be Russia or Brazil or whatever the hot spot is at the time.
Right.
So I try to get it from them. Now, some of them are very interesting. You know, Brazil is, of course, they're a very controversial leader. Put things on there promoting the way Brazil's handling it, even though things don't work that well. Russia is kind of the same way. Venezuela, they're blaming everybody for COVID but themselves. So it just varies. But I do kind of steer clear from a lot of the mainstream media because it's very sensationalized, and I try to avoid that as much as possible. But sometimes you do get some good quotes out of it. But it's hard. It's hard. I mean, it's hard to find good numbers as far as particularly the models. Models are all over the map.
Right. So do you focus more on total death count, total case counts? What piece of data do you kind of look at? Because for me, I've kind of drifted away from total cases, because if we run 1 million tests, we're going to have more positives than if we run 100,000 tests. So I've kind of focused just on the graphs. And again, if I go to Worldometers, at the bottom, there's just graphs. And you can just kind of see the charts to kind of see, and really for the last 30 days, we've kind of gotten very, very flat.
Right.
But talk a little bit about which pieces of data are even worth paying attention to.
Well, you're right. You're 100% correct. I mean, the case counts is a direct result of the massive testing that's going on. In the United States right now, for example, we're doing about 400,000 tests a day.
Oh, it's a lot more than I thought there was. Yeah.
It's really funny. I was watching this interview with Mika Brzezinski the other day. She has some kind of expert. Everybody's an expert, right? And
except for you. You haven't been invited on CNN yet, as far as I know.
Haven't.
Okay,
I don't
just
think
checking.
it's going to happen anytime soon.
Yeah, the worm and germ guy doesn't make it.
No. But this expert said we should be doing 23 million tests a day.
23 million, really? Yeah. 400,000, 23 million. We have just a random number.
Yeah, but which is, there's not supplies, there's not people to do the tests. It's theoretically
just an absurd number that somebody comes up with.
So I like I said before, cable news I definitely avoid because they are so sensationalized. As far as the numbers, I do look at case counts, particularly if there's a headline that I want. So Brazil went over 400,000. I need that information. But to find out what's really important is I do look at the death count, but not by itself. I look at it, if it's available, I'll try to break it down by age. And as you can see, in almost every country, it's 85%, maybe a little bit less, of the fatalities are in people 65 and older. And as far as from a policy aspect, that's clearly the most important one, because you don't want to shut everything down with the younger people when you can kind of just try to protect those vulnerable people.
Right.
And you wouldn't have economies in turmoil right now.
Right.
But
So,
that is something I look at, even in Florida.
yeah.
Yeah.
So let me review. You run Outbreak News Today for us. You're pulling data directly from Ministry of Public Health sites, verifying a lot of the guidance through Johns Hopkins, trying to get into where there are raw numbers and that kind of thing. For me, like I said, I kind of use just because Worldometers just kind of populates in real time. It kind of gives me some charts and graphs. I can see some of that kind of thing. Where do you see kind of our current state in that? And let me ask it in a compare and contrast. What do we know now in May, as May's coming to an end, that we didn't know, let's say, in March and April? Because my tone has changed dramatically, right? I was erring on the side of conservative.
Yeah.
We were seeing numbers. My concern was we were seeing numbers that were still doubling, right? So 250 becomes 500, becomes 1,000, becomes 2,000 every 3 days. And until we knew what that would look like, not just in New York City, but everywhere else, I was like, we have to err on the side of caution at least a little bit longer to get data. But now we've gone too long. We went way past knowing that. The graph actually didn't get flat. It actually been down.
Yeah.
Where are you at on your scope of what today looks like compared to, let's say, March and April?
Well, I would say...
Goodness, our storm is rolling through, folks.
There
This will
we
be
are. Welcome
this will
to
be
the show.
a video to remember.
There's been a lot of research. Of course, there's tons of money being dumped into research
Sure.
and testing and everything else. A lot of good research that's been done, so we have learned some things. What have we learned? We've learned about ACE2, and that's angiotensin converting enzyme 2, I believe. And why is that important? That's kind of the doorway for the virus into the body.
Right.
And why is that important? Well, we're seeing around the world that men are having more severe cases. They are higher rates of death, and that's because men naturally have more of this ACE2 in their body.
Okay, so we have more ACE2,
Right.
so we have more gateways to get more
Absolutely.
virus. So just biologically, there's a difference between a genetic male and female in the amount of ACE2 the receptors that we have.
Yeah, according to the research. Yeah,
Okay.
that's what they're saying, and I believe it. Also, we know a little bit about the severe pathology, and that is something called cytokine storm.
Yep.
You've heard of that? You've heard of that, right?
Yeah.
So the immune system just goes wild, and basically you start getting all this massive inflammation, and frequently you can die from that.
And as I understand it, the body almost attacks itself. It gets confused by what is infection and dead cells it's supposed to destroy. It'll destroy healthy tissue as well. And once you're on that slippery slope, they haven't really found successful ways to really stop a lot of that in this elderly population.
It's really hard. It's really
Yeah.
hard. And another thing is, as far as pathology, I think that's where we've seen a lot of progress. Is a lot of people are, particularly in the African American community, is the issue of blood clots because of this. So now that they know this kind of stuff, they can give blood thinners and that kind of therapy to help these patients. So I think those things are pretty important. Let me check my list to see what else I put down here. Oh, other parts of pathology is somewhere between 60 and 80% of people that experience COVID experience a loss of taste and smell.
Right.
Yeah, so that's kind of interesting. But
And that was a key indicator, because I know I've been tested basically 3 times. I had an antibody test, then I've been tested before a procedure and right before a procedure. And there's a lot of focus on shortness of breath and loss of taste or smell. And those were 2 huge parameters that they were asking for every time, asking multiple times, that kind of thing. So I guess that's kind of a very common theme that we have seen from our, because I don't really count the data from China. I count the data from Europe and then kind of going forward. So that's pretty much how you've approached it too, or some of that data. So I'm not going to disregard China 100%, but I'm not going to take raw numbers. I'm just going to be like, all right, whatever.
Well, and there's other countries that are like that. I mean,
Yeah, you mentioned Brazil and Venezuela. We're not going to get good data.
well, Brazil's probably pretty good. It's just that they're putting out little statements on their website like, hey, we're doing everything we can, that kind of. So they're really kind of promote that. But even at first, I was wondering about Russia. It's like,
They had no cases for the longest time.
the longest time.
But we know they shut their borders down. Like, there were really border shutdowns back when China was flared up, Europe was flaring up, and they literally were shut. You could not get in and out of Russia. And then we have this massive surge now in the last year. Let me shift gears, because